Priya Dutt here. Very good evening. Thank you for gracing us. A big thank you to Dr. Purvish Parekh for doing the honors, and a huge vote of thanks to all the eminent panelists. And we are here graced by our stars of the evening, Mr. Sanjay Dutt, Mrs. Priya Dutt, Dr. Mrs. Tarang Gyan Chandani, and Dr. Vijay Haribhakti. Kumar sir, we missed you. Are you in the room? We still need to.
Kumar Prabhash. Thank you, sir.
We haven't felicitated Dr. Kumar Prabhash. Kumar sir.
Kumar कहाँ है? हाँ कुमार प्रभाष. I.
I would like to welcome Mr. Sanjay Dutt, Mrs. Priya Dutt, Dr. Tarang Gyan Chandani onto the stage. Cheers. Sir को रहने देते हैं. Sir को रहने देते हैं stage पे. Sir, please be on the stage, sir. Sir, please be on the stage. हाँ? हो गया. ये बाहर निकाल दो. It's okay. It's okay. It's okay. Please come. Hari Bhakti sir, we are looking for you. And Dr. Moni Kuriakos sir. Dr. Moni, please. Sir, please. Venkat is not here, right? Okay. Please. So thank you, and thank you, very big thank you to the media as well, but we just wish to take it on now further. And firstly, I would say a huge thank you to Mr. Sanjay Dutt and Mrs. Priya Dutt for gracing us on this occasion. And just to fill you in, we have a room full of international and national faculty deliberating on precision oncology. This is a collaborative evening with Sir H.N. Reliance Foundation Hospital, and we are hosting Karkinos here, and Karkinos international delegates were just up here deliberating on precision. And thank you for making time to really elevate the cause and bring it out up front. I would also take a moment to thank Dr. Tarang Gyan Chandani for backing this event in the way she did. So really grateful. and also grateful for elevating the cause, backing us all in precision, for first of all hiring me to lead the precision division, and really, really grateful for that. Because I say this, because in India, and we heard Mr. Vivek Badwa, how we are far behind. But in India, even to make a mark and come in to put up a precision clinic, to put up a precision center, was a huge effort. It was audacious, to say the least. And I look forward to the collaboration that we have out here today to see how we can take precision forward to the next level and really meet expectations of Mr. Vivek Badwa as presented in the last panel discussion. So with that, I thank Dr. Advani sir, Dr. Moni Koryakos, Dr. Vijay Haribhakti sir, all of you all for gracing us this evening and for your valuable time. We will go ahead with a few events next. We'll go ahead with the lighting of the lamp. Then we'll have a quick word from Dr. Tarang. Then we will do a launch of our patient navigation program with Mrs. Priya Dutt and Dr. Tarang. And then myself and Mr. Sanjay Dutt will sit in a conversation to highlight some of the precision facts. And I know his words will reach the masses, which will go beyond the limitations of the four walls of this hall, because he is a star and he is a precision poster child. Thank you so much. I welcome you all for the lamp lighting. Just give us a moment to do the preparations. Who's helping us with the lamp lighting, guys? So the lamp lighting is being done to really bring the cause of precision forward, to wish for progress of precision, to wish for progress of personalized and individualized therapy, and to wish and hope that it comes true, that the revolution arrives in this very decade, and Mr. Badwa's words, to cure cancer in this decade, happens. Amen to that. Could we please have the Saraswati Vandana? Goddess Saraswati is the goddess of knowledge, wisdom, and we are all here today to worship that. Thank you, dignitaries. We move on to the next segment, where I would just request Dr. Taram to say a few words.
Dear faculties, oncology experts, Reliance Foundation Hospital Precision Oncology team, the Kakinos team, cancer survivors, cancer warriors, and their families, students, and other guests. A very warm good evening to all of you from all of us. Thank you so much for coming here today this evening to be a part of this one-of-a-kind event. I would also like to specially mention how thankful we are to you, Dr. Sevanthi, for organizing such an event. And it's all because of the fact that she believes so much in precision oncology. She believes so much in this vision to get the best to the people of India. So, very, very warm thank you to you, Dr. Sevanthi. In the beginning of this, she mentioned to me that thanks for us to hire her. I would like to say that I can only say that we brought her to the place where she belongs to. It's been only a few months that we have her, but I don't think any one of us in RFH feels that it's been only a few months. We feel that she's always been a part of us. So I think we have just brought the right person to the right place to do the best for the people of our country. Cancer, as we all know, is a ruthless disease. It evolves constantly and spreads relentlessly. It's hard to catch and even harder to treat. However, with precision oncology, the world of cancer treatment is changing. While the traditional methods treat cancer by disease type, precision oncology brings in the integration of molecular tumor profiles into clinical decision making to provide the best cancer treatment. With the increasing use of genomic profiling for diagnosis and therapy guidance in many tumor types, precision oncology is rapidly reshaping cancer care. The goal of precision medicine is simply to deliver the right cancer treatment to the right patient at the right dose and at the right time. Each patient is unique for us at Sir H.N. Reliance Foundation Hospital, and we are indeed committed to the concept of precision in whatever we do. And I'm proud to say that we run the first precision cancer centers in the country. We are moving towards complete digitization of the hospital where data retrieval, data sharing would become an easy possibility. We are also committed to investigator-initiated and industry-based research and have taken several steps to facilitate that. We have also partnered with ILON Precision Oncology in a unique effort to bring the best of global precision oncology care to our patients, not only in Mumbai but across India. We welcome the possibilities of collaborative work with Kakinos. We are already working together in the area of cancer screening with Kakinos, for which we provide access to Kakinos for diagnosing and screening those people who usually don't have an access to the highest level of cancer screening or highest level of cancer care. And through the initiative of Reliance Foundation and Sir H.N. Reliance Foundation Hospital, all these patients who are screened and come out with to be positive with cancer are treated for free by our experts with the best of precision oncology that we could bring to them. At the Reliance Foundation Hospital, we are dedicated to world-class cancer care and precision efforts. And with this, I would also like to welcome all of you to this great evening. And I hope you all will enjoy your interactions, whatever you have had so far and whatever we will have going forwards. I would also like to once again thank all the experts in the field of oncology who are here today and who have blessed us with their presence today. I think we all need a forum and we all need a place to come together to do the best, and the patient navigation system, which we would be launching soon at Sir H.M. Reliance Foundation Hospital this evening, will help us to ensure that we play some role in navigating the patient's journey when he or she is diagnosed with this deadly disease. Most of the time we always feel, and this I have seen with many patients, whether the patient comes from whichever background, it doesn't matter, but nobody knows what should I do, where do I go, what should be the next step of my treatment. So this patient navigation system will just try and integrate our efforts so that we can get the best to our patients across the country. It may not be always through our hospital because we are here as of now only in Mumbai, but it will be through whichever of the best of the experts is situated in the country or beyond the country to give them the best care. So once again, I congratulate you, Dr. Sevanti, for this wonderful initiative. And with this, I would also like to pay my humble gratitude to a legend in the field of oncology, which is nobody else, none other than Dr. S.H. Advani. So thank you so much, sir, for being here on this day with us. I'm always grateful to him that he has always showered his blessings for whichever effort I, in my personal capacity, have ever done for cancer, and he's always been there. So really thank you so much, sir. And last but not the least, the person who had the vision for providing the best cancer care at Sir H.M. Reliance Foundation Hospital, who started this path, who created the department, and who has treated and cured, I'm not sure whether I can say millions, but I'm sure it is millions of patients. So Dr. Vijay Haribhakti, thank you so much for this and for all your efforts. And I'm sure with all of you here in the audience, we would be able to definitely embark on this journey of precision oncology with the torch that Dr. Sevanti is carrying in her hand. We just need to ensure that we carry it to everybody in the country and it does not get restricted only to a few people. So thank you so much and have a great evening ahead. Thanks a lot.
Thank you, Dr. Taram. That was amazing. That was so encouraging. Coming from you, I have always, right from my first interaction, been very inspired by your leadership and by your backing. And coming from you, I'm sure there's a loud and clear message that goes out to the masses, to the leaderships in the country, and also to international leadership. We really need to put precision up front and center on the table. With that, I come to the next section of the program where we launch our patient navigation program. We will just go ahead with the video. In the meantime, we'll unveil the poster with our esteemed guests here. And in that, I would like to specially dedicate this to Mrs. Priya Dutt. Thank you for being here this evening and for all your work growth in cancer care with the Sanjay Dutt Foundation, above and beyond. We have been inspired by your journey. I know patient navigation is very close to your heart, and for that very reason, there wasn't a better day, there wasn't a better moment than to launch this program in your presence. As we launched the patient navigation, we also launched 2 subparts of it, which will grow into fruition down the line. The first, precision navigation program. If you Google, you will not find a single precision navigation program worldwide. And I think it is the call of the hour in India to navigate our patients. The tests are difficult, the treatment even more difficult. So, precision navigation program looks at compassionate drug access, looks at clinical trials, looks at research-based therapy, looks at diagnostics, looks at guiding our patients to do the routine diagnostics and therapeutics. And lastly, many of my clinical trials have gone unfilled. These are cutting-edge immunotherapy drugs. So we also will be launching a vertical with research navigation program. And thank you, a big shout out to the patients and the patient families that are in the audience that have made this successful. After the video, we have a small slideshow acknowledging the contribution of the precision patients, and also to the patient advocates in the crowd, Mr. Prabhat Sinha, Mr. Sanjeev Sharma, people who have guided me really to bring this here. And last but not the least, to Ms. Sarika from Karkinos. And Karkinos is doing a tremendous job in patient navigation with a command center that is serving the community. We wish to have association initiatives like Karkinos on one side, be the anchor from the community to the corporate centers, leading centers in tier 1 cities, to the international connects with an initiative that I founded along with my dear colleague Dr. Sanjay Mani, like ILON Precision Oncology. There will be many initiatives like that if one can anchor with the help of navigation. You navigate the community, you navigate them to connect with the international availability of data, drugs, applications. With that, we will begin the launch and take a moment after that to hear from Mrs. Priya Dutt. We can start, and please bring the posters. Mr. Sanjeev Sharma, Mr. Prabhat Sinha, Ms. Sarika from Karkinos, you could just come up on stage, please. We can go ahead and open the ribbon, and the program is called Sarathi. As we know, Bhagwan Shri Krishna carried us all together through the chariot in Mahabharata. The Sarathi envisions to do that, to guide our patients, to help support who we care so much about through all the tests from diagnosis to therapy, through precision-based application, and through the clinical trial availability, research-based applications. A much needed effort in India. Tata Memorial Hospital has been an epitome where this kind of navigation has happened. I feel many corporates should take this initiative, and kudos to Karkinos to have done this in the community. We intend to bring it front and center in our corporate setting. Thank you all, and thank you for navigating me into this. Thank you. I would request you for your kind few words.
Thank you so much, Dr. Sevathi, esteemed guests on the dais, ladies and gentlemen. It's quite overwhelming for me to be here today, especially with a room full of oncologists. It's really humbling to see this program being launched because I represent those people who really cannot afford the kind of treatment what hospitals have to offer. Many of them, as you know, and I'm sure there are many doctors who have come from Tata Memorial Hospital, and we see the condition of the patients there. So many who can't even receive the treatment because they cannot afford it. Many abandon the treatment. So I think it's really, really important for programs like this, which can really help patients in need, patients who cannot afford. And we've been working in the field for the last 40 years, and we've seen how cancer treatment has improved tremendously. We've got the best hospitals, the best doctors. The treatment is getting better every day, but one thing remains is the cost of treatment. And I think that is something which we really have to look at. And I want to congratulate Dr. Sevathi to have thought of that. And I think this is going to be a huge step forward, especially for those patients who can come into clinical trials, can get the best treatment, and slow and steady, but I think we are going to be getting there very soon. So thank you so much for having me here and giving me this opportunity to say a few words. Thank you.
Thank you for gracing us. And now the section that everybody here is waiting for, my conversation with Mr. Sanjay Dutt. Yes, sir, that was the program. And thank you so much for all the senior delegates. Thank you. Thank you, Dr. Taram. Thank you. Chetan, you have to muscle up. So we are going to be joined by Mrs. Dutt, who needs no introduction, we better have, and Mr. Paresh Ghilani from the US. Mrs. Dutt is in Dubai. We have them joining in with us on Zoom. Mr. Sanjay Dutt needs no introduction. The entire room here has been waiting for him all evening. Thank you so much, Sanjay, for gracing us on this occasion. We know he's an award-winning actor. We know he is a light that many of us look up to. What we also know that he's one of the humblest human beings. It has been a true honor to serve you as your doctor. One of the things I always pull his leg on, I call him Sanju, he calls me Sevanti Ji. It's always been like that. It's so amazing. That's the degree of his humbleness. For the patients, the patient advocates who are in the room, for my colleagues, I want to bring to light what many of us already know, but would like to know from you directly. And I will begin from the beginning of your cancer journey. Sanju is also the global champion for cancer care and was appointed to be this by the Defeat NCD partnership based in Geneva, and he has been doing work on that with patient awareness, precision awareness. But this is something that happened later after the diagnosis. When he was diagnosed, of course, there must have been many, many emotions that he must have gone through. And so I begin with the question, what were the first feelings when you were told? And how did you react to it?
Good evening, everybody, and it's such an honor to be here today to share my experience. And I just want to thank everybody sitting here and who's willing to help people who are in need, like me. I just want to say that I am a real life hero, but she is the real hero here. You know, I mean, I do all the bashing and dancing on screen, but she does it in real life. And as your question goes, Sivantiji, is that, you know, I was just talking to my sister and Dr. Tarang and everybody inside, is that how do I come to know that I have cancer? I mean, I didn't know it. I mean, I had some backache and stuff like that, and I was just being treated, you know, with a hot water bottle and some painkillers. And till I just couldn't breathe, you know, one day. And I was taken to the hospital, and they saw there was a lot of water in my lungs. And they did some tapping stuff. And but the thing was that I had cancer was not broken to me in a proper way. You know, it was done in a different way where my wife was not there, my family, sisters, nobody was there, I was alone. And this guy walks up and he says, "You got cancer." So it hit me. I just couldn't understand it. And then my wife was at Dubai, and here she didn't know about it. Then Priya was told. Priya came, and she said that I think that you got cancer. So my first reaction was that, okay, I got cancer. What are you going to do about it? I mean, see, you know what happens? Your whole life reflects back on you. I mean, everything just came back, and my children and and I have a history in my family. My mom died of pancreatic cancer. My wife died of the brain cancer and everything. And it was like a shock. So the first thing I said was that, let it be, I don't want any treatment. So they said, you have to be treated. I said, I can't take chemotherapy and all that stuff, so let it be. And if it's meant to be, it's meant to be, and I'm going to go. So Rakesh Roshan ji, he spoke to me. And he says, Sanjay, there's this doctor, Sevanti. She's amazing and all that, and you go and be treated by her. I said, sir, I'm not interested. He said, I'll tell you something, she's really pretty also. I said, really? I said, then I'm going. Anyway, but I went and we met Sevanti ji. See, I realized one thing is that I had to fight this, and I just didn't have cancer. That is it. I've been treated for something else. And I think initially you couldn't understand, I mean, how come I'm telling you all that, right?
That's correct. That's very correct. He said, I'm going to just think I don't have cancer, and whatever it is, I'm going to beat it. That's how I'm going to take it. And I'm just sitting there staring at him, thinking, how we define denial in our books. And I thought, oh, he's in denial. But actually, he wasn't in denial. He had just pledged to go through this, be brave about it, and face it head on. And that's what played out through the treatment.
I saw my family break down. I saw my wife breaking down, I saw my sisters broken, I saw everybody breaking around me. And I decided one night, I sat down and I told myself, I said, if I break down, if I fall sick, they are going to fall sick. So I mean, I got to not fall sick. And I'm going to be so tough. I mean, what is cancer? I mean, I've fought so many battles, I'll fight this thing, whatever it is. And we went for the treatment, and there was a pipe put in my chest, I think to drain the water out. And I remember I told Sevanti, this is going to come out in 2 weeks. I told you this.
Yes, correct.
And what happened?
It did. And when he came back for the 2 weekly follow-up, I told the surgeon who put the tube in, we are in for a challenge because he's expecting that the tube will come out. And will it? Because it was all hemorrhagic, it was bloody pleural effusion, it was bloody fluid in the lung. But 2 weeks later, the fluid had already dried out. That's where I would like to mention the angle of precision. So, Sanjay, when we were testing you, before the treatment, we sent out some tests. We sent out blood tests, we sent out tissue-based tests, and now you're one of the biggest proponents of the testing. So we found a particular test that was positive.
PDL1.
PDL1 test was positive, and we drew diagrams and we drew if the PDL1 was this much, this is what the treatment will be. If the PDL1 was this much, this is what the treatment will be. But even with the biomarkers, Sanjay, and that's a confession, was overtreated. His PDL1 was very high, but still I didn't have the courage to give him only immunotherapy, which is the standard of care, and he was treated with combination chemotherapy and immunotherapy. And I would like to acknowledge that I did not cut any doses. He is a gentleman with a Caucasian build, and he was hammered with the right doses, 100% doses as per his body surface area. No corners cut. And the day of the therapy, and the next day, and the following day, and the day after, and the day after, he would continue to exercise every day, every single day. 2 hours on the treadmill, and I would get the WhatsApp of his exercises, and many of us who were involved in his care would get that. And you also went back to working almost right away. We want to hear from you how all that happened.
I realized one thing is that, I didn't want to lie about the cancer, people kind of don't want to make it public, and they want to just not tell people, and because, their work suffers, and there are a lot of factors which are involved in this. But I chose to speak about it, at the cost of my career or anything, so that I could help people who are in need, And I told Sevanti is that, Sevanti, can I please go for my shooting? So she said, no, you can't go for your shooting now, it's just started.
Peak of COVID. Peak of COVID.
Yeah, but chemo had just started.
Oh.
I said, you have to let me go. I said, it's for my my moral boost, and it's for the people of the industry who I'm working with, and I got to go for that shoot. I convinced her and I went. And she said, what is the shoot? I said, I just have to stand there and that's it, But it wasn't like that. I was put on a harness and I was hanging upside down. And
6 hours he was hanging upside down in a harness right after chemotherapy. I was told he was just going to do like a dubbing, a small shoot, something like that. But he was doing that. So one thing that he touched upon very, very quickly was one of his strongest points, and I want to bring that up front as I see I have Mrs. Priya Dutt in the crowd, and I see Mr. Paresh Gilani, Sanju's good friend here, and Mrs. Manita Dutt as well. One of the things that he touched upon was friends and family. And second thing he touched upon was being upfront. So when he came to treatment with me and I was getting hounded by media and I wouldn't pick up my phone, I said, Sanju, how do you want me to present the story? And he said, as is. I don't want to hide anything. You can go ahead and tell what you want to, as is, as I'm going through therapy, no changing of facts. That, I think, is very courageous. That, and the fact that he never hid anything from friends and family. And you can see his family and his friend from long distance, his lifetime friend, Mr. Paresh Gilani. Paresh, thank you so much for joining us. And Mana, thank you. A big thank you to you also for joining us.
Thank you, Doc, for having me. Thank you. Good evening, everybody. Thank you for having me.
And Paresh, do you want to say something?
Dr. Sananthi, obviously you've been a champion leading this entire effort and doing it. Obviously, and when this whole thing happened, it came shock to everyone, obviously, just as it is every patient actually does when they're told. It's the courage of the patient, which happens to be Sanju, we call him, and then it's Sanjay Dutt, and the family that comes around and then eventually leans into a caretaker who leads that, which is you, navigating the entire thing. It was a complex world where we found out. It was COVID, midst of the COVID, don't know what to do, can't stay in the hospital, you may get infected. If you stay there, if you get out, what do you do? It was a chaos in many ways. And how it actually became together as Priya stepped in immediately. Mana unfortunately was in Dubai, I was in the US, how it had to be collaborated, but then it was anchored around you to actually lead us to what it is. Courage of Sanju, which is always shown in many ways, to just buckle up and say, let's face this, and take the bull by the horn, ride it. You led us and we support it. And obviously the navigation part was extremely important, and I believe how it all came together is obviously a miracle, but it was also very deliberate, and a part of exploring every option that we had. You actually led the way, and obviously the hospital at that point was Kokilaben and your support staffs and everybody. It was definitely an effort, which I believe that should be spread and also been learned from. Giving all the tools and access we had, obviously it was limited because of COVID, but I truly believe that what you have led, along with Sanjay's courage, we're just Priya, myself, Mana, and everybody just playing a supporting cast.
Thank you, and a big thank you to you too, Paresh, for all your support all the way through, and for being Sanju's biggest support so far, and of course his lifetime friend. So thank you, Paresh, for joining us as well.
I must say, right, that Sanju didn't stop because he said, okay, this is a treatment for me. And he literally sensed, because when he said, he goes, brother, listen, I have it, mom had it, wife had it, this happened, what do we do as I go along? He always kept in mind, said, well, okay, fine, we're getting this, and we can get into details later, but how do we explore this precision medicine and its extremely cutting edge technologies that we actually are researching around the world? And then when he mentioned, I said, bro, these options are here. Intimately, we're not gonna have any stone untorn for your care. Let's start with what you're doing, and then we move on to make sure that we have even as a secondary, third, second, fourth option stuff. And then when he visited, and obviously he came to US, for exploring, his first thing was, brother, listen, not everybody will have this access. How do we extend this thing to everyone else? Where they can't afford. Very very similar to Manu used to say, right? How do I afford the diagnostics? How do people even know they have cancer? How do we do that? And then he was constantly involved. How do we take this, what I'm able to access, take it back home and explore it to everybody? And which is, I believe, the man just faces everything head on. Along with it, he kept saying, hey, is there anything we can help everybody along with it? They will never have access to this, what you have and what we have, right? Which is, I truly believe that's one of you trying to bring back to, to the mass access, and I commend you for it.
Yes, that is the hope, that's the goal, and the reason to really welcome Sanju to this stage was to raise the awareness, elevate the cause, bring it to be bigger than me and the doctors in this room. It's all about the patient. It's all about him, how he sought the diagnostics, how he turned around to take the treatment. Someone who had the first thoughts of not getting treated, then treated and in complete remission, and what a story. I say Sanjay Dutt, Mr. Sanjay Dutt is a poster child of precision oncology, and 2 years later, even the immunotherapy has been stopped. He remains in complete remission with no evidence of disease. With that, I thank Paresh, and I would like to welcome Mrs. Manita Dutt. Mana, would you like to say something?
This topic is so close to my heart that, every time I fall short of words, because there's so much in my heart that, my emotions take over my words, and I'm always short of words. But, I know having said that, Priya has been like fantastic with everything, of course, it's not just because she has been dealing with a lot of cancer patients, or cancer has been like in the family with my mother-in-law and with Richa, but also she's such a strong person. And that time I was not there. I flew in the next day after the news was broken out to Sanju. As you said, you felt Sanju was in a stage of denial, but when I looked at Sanju, he was very composed, he was calm, and he just looked at me and he said, "Mom, get ready to fight." And this is what I've been doing since the time that I know him, 18 years of my life that I have been with him. I have done one thing blindly, is I've believed in him. I have trusted his instinct, and so I was like, okay. And we decided as parents to Sharan and Ikra that we are not going to expose them a lot to what we are going through, and that has always been a strong decision from us as parents, and that we believed in. And of course, and I just followed Sanju. I am personally a strong believer of being very positive with my approach towards life. I believe what you throw to the universe comes back to you. And Sanju was just practicing that. He said, "I do not have cancer. I'm going to fight it." And that's how it went. So we had all the planning in place, but execution requires a lot of discipline. I was a bit worried, knowing Sanju, I've been 15 years of marriage and knowing him for 18 years. He's the most undisciplined person. We all know, he has been, there, but, this was a task. But, how beautifully he has just molded himself. And, I feel, every time there is something that has gone wrong, the most righteous way, the righteous person has come out of it. So I feel so proud, and I feel great that today he's there as a face of this cause. And just keep it going, stay strong, because I feel, Sanju, you are there, born here not for being entertaining. You said you're a real life hero, but I feel you're born for a much larger cause in life. You have been, face of so many good causes, but I think this is putting your life there and teaching people, look, I have done it, you can do it. I think this is something, I feel proud, and I feel it's very commendable. And of course, Dr. Sivanti, you have been a very strong part and supportive part of this entire journey. I know I've had this crazy conversations with you. I of course, because of the time difference, I would call you at odd hours, and you have always been very supportive, not only as a doctor, but also as a guiding person, because I was going through a lot of emotional turmoil, and as I promised to Sanjay that I will stay strong, I had to stay strong. But so you have always been there supporting me, guiding me, and yes, so thank you everybody, and yeah.
Thank you. Mana, you said it right. You said it so right. He is the brave one. And through all the stories of indiscipline, Sanju was the patient who turned up on time every time. He never broke rules. He sailed through all the treatment. He took all the medicines on time. He took all the injections on time. He turned up for all his tests. So that's a testimony of his integrity as presented by Mrs. Manyata Dutt. And kudos to you, and more power to you, and more power to your message and your ability to come up front to the masses and share your story. Honored.
I just want to thank everybody sitting here to hear a little part of the story. I can go on and on, but it is so important that you have family support. I mean, it is so important for a patient that you have a beautiful family who stands like pillars in your life. I thank Mana, I thank my wonderful brother Paresh, I thank my beautiful sister Priya and Namrita and the kids and everybody. But that's taken for granted, that's going to be there, these people. But most of all, to have a supportive doctor for a patient. She is the Munna Bhai MBBS. And along with her is her team of Rutu and Chetan and Dr. Hemant and where's my darling Gina? There she is. The most wonderful team, they never made me feel like a patient. They made me feel like a king. And that is the beauty. I mean, it's just a touch from a doctor. It's a different ballgame, I mean, doctors are busy and everything like that, but it's just that these people are amazing, and I think all the guys who are becoming doctors should learn from this team, because I've experienced the team for 2.5 years, nearly 3 years, and it's more of giving you that boost and that. I hate injections, but yet they.
Yes, that's the toughest thing. Any blood draw and any injection is the toughest thing. We have to really work our way through. But thank you, Sanju, for making time.
Thank you.
And Dr. Tarang wanted to say a few words, but before, if you could, should I bring the mic there?
Thank you all. Thank you so much. Thank you so much. नहीं वो खड़े रहे बोले ना बोल रहा
आवाज नहीं है मेरा रिक्वेस्ट है kindly make it quick because he was about to leave.
आप बोलिए ना अभी यार
And no further questions strictly. They are only
शुरू करें क्या संजय सर कैंसर की जो आपकी जर्नी रही है काफ़ी इंस्पायरिंग है, जैसे कि आप स्टेज पे बता रहे थे, कुछ अगर हमारे साथ हिंदी में साझा करना चाहें कि कैसे आपने फाइट आउट किया और कैसे डिसाइड किया?
देखिए, सबसे पहले मैं यही कहना चाहता हूँ कि अगर आपको ऐसा महसूस होए तो आपको टेस्ट करना बहुत ज़रूरी है. मतलब आई थिंक टेस्टिंग बहुत ज़रूरी चीज़ होती है. मतलब हर 6 महीने में आदमी टेस्ट करे, जो स्मोकर हो या जो तंबाकू खाता हो, बिल्कुल उसमें कोई डरने की बात नहीं है, क्योंकि अर्ली डिटेक्शन इज़ द मेन थिंग. आई थिंक जो मैं कह रहा हूँ तो लेकिन वो करना बहुत ज़रूरी है, उससे डरना नहीं है. वो ट्रीटेबल चीज़ है. जैसे कि प्रिसीजन की बात कर रहे थे, अगर आपका पीडीएल लेवल बहुत अच्छा है तो हो जाता है काम, और सब यहाँ की बात है, और अगर फाइट करना है तो करना है।
हम चाहेंगे आप वो पल बताएं जब आपको पहली बार बताया गया था कि कैंसर है। अभी आप स्टेज पे बोल रहे थे, हम चाहेंगे कि आप थोड़ा उसके बारे में बोलें कि जब आपको पहली बार बताया गया और कैसा रिएक्शन था।
वापस डायलॉग बोलूँ वो?
हिंदी में।
नहीं, वो पल देखिए, कैंसर एक ऐसा शब्द हो गया है जैसे कि मतलब कि कैंसर हो गया है, ये हो गया। मैं समझता हूँ कि कैंसर एक बुरी बीमारी है, लेकिन हार्ट अटैक भी उतना ही बुरा है, किडनी फेलियर भी उतना ही ख़राब है, लिवर ट्रांसप्लांट भी उतना ही है, उससे भी ज़्यादा है, यू नो। एंड लेकिन इससे आदमी को क्यों डर लगता है? क्योंकि इसको एक बढ़ा चढ़ा के बोला गया है। ये भी एक डिजीज़ है जिसका हम सामना कर सकते हैं, और सामना करना ही चाहिए मेरे हिसाब से। तो जी, मुझे डर लगा, मैंने सोचा कि अभी क्या होगा, यू नो, लेकिन कुछ नहीं हो सकता। जब इंसान अपने दिमाग से लड़े और दिमाग को मजबूत बनाए तो सब काबिल हो जाता है।
हम चाहेंगे आप
ऐसी बातें हो रही हैं क्योंकि आज आप यहाँ पर आप लोग हैं, ऐसी बातें हो रही जब से कोविड आया तब से कैंसर बहुत ही तेजी से बढ़ गया है। तो इसके पीछे क्या कुछ सच्चाई है? क्या कुछ कि अगर आप कुछ बताना चाहें कि कैंसर क्या है वो कोविड जब से आया?
कोविड आया तो कैंसर बढ़ा नहीं है, कैंसर की डायग्नोसिस बढ़ गई है क्योंकि स्कैन्स ज़्यादा हो रहे हैं कोविड के वजह से। आई वुड लाइक टू जस्ट स्टैंड अप बिकॉज़ मिसेस प्रिया दत्त इज हियर। आप आइए।
मैं हो गया मेरा, मैं जाऊँ? अभी क्या बोल रहे हैं?
बैठ 2 मिनट। हाँ, तो ऐसा नहीं है कि कैंसर के रेट्स बढ़ गए हैं, पर कैंसर का डिटेक्शन बढ़ गया क्योंकि स्कैन्स हो रहे हैं कोविड की वजह से इतना। और
आपके घर वालों के लिए कितना मुश्किल पल था संजय सर जब ये खबर आई कि आपको कैंसर है?
घर वाला एक बगल में ही बैठा है, उनसे पूछिए।
उनसे पूछिए।
नहीं, हर किसी घर की तरह आई थिंक यू नो तकलीफ तो होती है, एंड आई थिंक यू नो पहले तो बहुत घबराहट होती है, उसके बाद आई थिंक यू हैव टू फोकस ऑन व्हाट इज़ देयर ऑन हैंड और उस हिसाब से आगे बढ़ना पड़ता है। तो आई थिंक यू नो किसी के भी घर में अगर ये कैंसर वर्ड भी आ जाए तो आप सब जानते हैं कि क्या हालत हो जाती है।
प्रवृत्ति जी, जब संजय सर आपके पास इलाज के लिए आए थे, जैसे कि वो बता रहे थे, काफ़ी ब्रेव तरीके से उन्होंने कहा कि मुझे कैंसर नहीं है और एक सामान्य बीमारी की तरह ले रहे थे, उसके बारे में कुछ बताएंगे?
तो सिर्फ अभी ब्रेव नहीं है, वो शुरू से ही इतने ब्रेव थे। जब पहली दफ़ा मैं उनसे मिली थी, जब वो फर्स्ट टाइम आए थे मुझसे एज अ पेशेंट डॉक्टर मिलने के लिए, तब भी वो बिल्कुल पेशेंट के जैसे नहीं लग रहे थे। वो बहुत कॉन्फिडेंस से आए थे और उनका पूरा परिवार उनके साथ आया था। ये बात मैं एक्नॉलेज करना चाहूँगी। उनके पीछे उनका पूरा परिवार उनके पीछे था। उनकी पत्नी जो यहाँ नहीं थी वो वीडियो कॉल पे थी, तो पूरा परिवार उनको सपोर्ट कर रहा था और बहुत ही हिम्मत के साथ आए थे। और मैंने उनको ये कहा भी था उस दिन कि आप पेशेंट तो बिल्कुल नहीं लग रहे।
डॉक्टर तरंग और डॉक्टर से जानना चाहूँगी कि ये जो लाइफस्टाइल में बदलाव की वजह से पिछले कुछ सालों से हमने देखा है कि बहुत ज़्यादा कैंसर के केसेस सामने आए हैं। आपको क्या लगता है कि किस तरह के लाइफस्टाइल चेंजेस लोगों को अपनाने चाहिए जिसकी वजह से इस कैंसर को अवॉइड किया जा सके?
सो आई थिंक सबसे पहला तो आई थिंक द मोस्ट इम्पॉर्टेंट क्वेश्चन जो आपने पूछा था कोविड के लिए, कोविड के बाद से कैंसर रेट एक इस वजह से भी बढ़े हैं क्योंकि 1 साल तक लोग हॉस्पिटल नहीं जा पाए थे। तो जिसने भी अपना हेल्थ चेकअप कराना था वो हेल्थ चेकअप पोस्टपोन कर दिया गया था। तो उसकी वजह से अब जब लोग चेकअप करा रहे हैं तो नंबर्स आर कमिंग मोर। सेकेंड, आई थिंक लाइफस्टाइल में द मोस्ट इम्पॉर्टेंट थिंग इज़ द डिसिप्लिन। आई थिंक डॉक्टर सेवंती ने मिस्टर दत्त के बारे में भी बताया दैट इवन व्हेन ही वाज ऑन कीमोथेरेपी वो एक्सरसाइज करते थे। सो आई थिंक दैट इज़ समथिंग एज अ लाइफस्टाइल वी हैव टू फॉलो। वी डोंट हैव टू एक्सरसाइज हैज़ टू बी डन जैसे कि हम सुबह उठ के ब्रश करते हैं। सो जैसे अगर हम ब्रश करना नहीं भूल सकते, हम नाश्ता करना नहीं भूल सकते, वैसे हम एक्सरसाइज करना हमें नहीं भूलना चाहिए. एंड आई थिंक हेल्दी डाइट एंड हेल्दी एक्सरसाइज इज समथिंग जिससे नॉट ओनली कैंसर, आप बाकी सब प्रॉब्लम्स को भी जल्दी इंश्योर कर सकते हैं कि वो होए ना, और अगर होए तो वी कम आउट ऑफ इट strongly because the body is healthy. That is most important. And health checkups are very important.
So what does a day in your life look like right now? And how has your perception in life changed? Perception towards life. So there are two questions.
How does a day
What
in
is
life looks right
A
now?
day?
Yeah, what is a day in your life like right now? And
Well,
what
the
has
day
your
in my life
perception-
right now is like every normal day in anybody's life.
Right.
I mean, I go
What has
to.
changed? Yeah, I mean in your routine. Yeah.
What has changed? I've become more disciplined. You heard my wife saying that. You know, so I mean.
Now, let me just tell you that he has really gotten involved in fitness. We have actually from Reliance also been working with him for the nutrition, for the fitness.
But he used to be into fitness earlier also. What has changed in terms of fitness?
So
Like, what
there
is
was
he
a
doing
gap
more now?
during the therapy, initial therapy.
Yeah.
It wasn't being done to that extent.
Okay.
And now, Sanjay, about
Yeah, if you would
weight
like to-
loss and
देखिए, I tell you one thing कि फिटनेस से, एक्सरसाइज से और एक हेल्दी वातावरण से
Yeah.
आपका इम्यून सिस्टम बढ़ता है, एक बूस्ट होता है,
Yeah.
जो इम्यूनोथेरेपी से भी होता है.
Right.
लेकिन नेचुरल बूस्ट आपको व्यायाम से,
Right.
एक हेल्दी डाइट से बहुत बहुत होता है, जो आई थिंक लोगों को ये समझना चाहिए और सीखना चाहिए,
Right. Right.
यू नो, टू कॉम्बैट एनीथिंग. तो ये सब चीज़ें, ये चेंज आया है.
What
मैंने
has been your biggest learning, sir, after this experience?
डोंट टेक लाइफ फॉर ग्रांटेड, एज सिंपल एज दैट. नाउ आई कैन गो.
thank you so much. Thank you. Priya.
मैं अपना चल
आ जाओ.
Thank you, sir. Thank you very much.